tēnei takumihi atu kia koutou, kia tātou katoa, I roto I te kaupapa o tēnei hanga e ki ake nei ko te haura. Kia ora everyone, my name is Professor Meihana Durie. I'm the Deputy Vice Chancellor at Massey University and the Head of School Te Pūtahi a Toi. I'm also a Māori health researcher and a promoter of all things Māori in fact, but I have a particular interest in advancing and progressing outcomes for Māori wellbeing, particularly within the context and realm of haura and through the vehicle of mātauranga Māori. Nō reira, kia ora tātou. When I think about our tamariki and mokopuna and what the future holds, I think it's absolutely critical to ensure that there is tino rangatiratanga for Māori in the haura space. And by that, what I mean is that we have full and total determination of outcomes in health and well-being for our people. And that it's us as whānau, as hapu, as iwi, as communities who determine what a good outcome looks like. I'm also thinking of the notion of mana motuhake. For my tamariki, for example, I would want them to be able to have access to Māori doctors in a space that is reflective of te ao Māori. I would want them to be able to have their consultation and their appointment in their first language, which is te reo Māori. And most importantly, I would want them to feel entirely comfortable as Māori in that space. Secondly, I think beyond doctors and GPs, I would also like to think that they can have access to other providers of wellness and well-being who are Māori. So all of those things I think are not beyond our reach, and when I think of what paiora looks like, each and every moving part of our wellness, our well-being, for me that's what a flourishing future would look like. Well, I think first and foremost we need to overhaul the current structure, the current system in terms of the provision of health services for Māori. And I would add to that by Māori. So we need to have more of our own people who have access to the education to become doctors, to become GPs, to become exercise physiologists, to become cardiologists. We need to have I think an intensified approach which ensures that young people, and by young I mean late primary school, early secondary school, are in the pipeline to have the sufficient qualifications necessary to receive the education to move into those positions. So it should be by design and not by default. And also that those who may work in other areas such as whānau ora and anything and everything that has something to do with haura, that we can ensure that they have the education necessary to go through their training and education who come back into our communities. What we know that works are the provision of kaupapa Māori health services, and we see time and time again the impact and effectiveness of Māori health providers where there is a clear, Māori cultural identity within the organisation itself. Research tells us that in the last 25 years we've made huge gains in terms of whānau flourishing, in terms of haura. We know that te reo, for example, is a huge contributor to outcomes across other areas. We've seen kaupapa such as Ai Māori, for example, change the discussion about what it means to be engaging in physical activity and optimal nutrition. But there are also a whole range of other things that we require, and there are still some barriers for us in terms of our reach into communities. So those are the things that I think will be needed in the first few years as we start to take check of what we have already, what works, but also what else might be needed. In terms of working together effectively in terms of a partnership with the Crown, that's important, but it shouldn't stop those who are out there in our communities having that degree of tino rangatiratanga, mana motuhake, over their own ways of doing things. We know that in the past, being told what to do hasn't been the best thing for those who are providing health services in our communities, because there is such a broad and diverse range of needs. So history tells us, and our ancestors actually tell us, that we get the best outcomes when we work together for a common vision. And I think having that common vision for paiora is the thing that's going to unite us. When we think about paiora, it's everything and anything to do with Māori flourishing, Māori being well and healthy. And once we understand that that's the common goal for not only us as Māori, but for Aotearoa more broadly, we can see that those are the things that are going to unite us. Ko te wahanga ki a tātou i enei rā, i tēnei ao hurihuri. Ki aro ki ngā tohu, kei wainga nui i tēnei ao ngā ao hurihuri. Ki aro tātou ki ngā kaupapa tuku iho. Kia piki ai te hauora ki ona taumata whakatikitiki. Nō reira, kia ora tātou katoa.